Hi Celia. Are you ready to review the lesson for the upcoming test? Okay, let's start from the beginning. We will go over the lesson, Communication and the Clinical Interview. From Chapter 10.
Remember that in the communication process the sender initiates contact.
Okay, and I read it is the stimulus for information, to provide comfort or advice.
Remember that message and communication is either sent or expressed.
I know, and communication is established from the medias of hearing, visual, touch and smell.
You could have just said the 5 senses. I would have understood, and when feedback is received the initial communication has begun. Yeah.
Question: how is it that factors affect how we communicate?
Well, when considering that different factors affect communication, you can understand the vested interests of personal factors and relationship factors. It is an effort from the person who is communicating.
But what about environmental factors?
Look it up in your book, you will remember it better.
Everybody's got jokes.
Next, let's discuss verbal communication. It is all the words a person speaks. When one communicates to someone, they bring their beliefs, values, perceptions and meaning in a conversation. Do you mean those things that are important to the person or the communicator?
Yes, that is exactly what I mean. Sometimes the message that is being conveyed is just not clear. I often hear mixed messages, insults and judgments when I'm just trying to get a simple answer.
So being aware of these pitfalls can improve communication?
Here are some good techniques that can enhance clarification when communicating. Paraphrasing, restating what was said, reflecting on what was said and exploring what? The conversation.
Just pay attention. When you want to get information from patient, remember to use open-ended questions.
I know so that the patient can give more information.
The more information we have, the better we can help our patients.
The closed-ended questions will give short answers and not much information will be collected.
By all means, when trying to establish a therapeutic relationship, don't keep asking lots of questions. Avoid giving approval or disapproval in a conversation. And please don't give advice and do not ask those why questions.
As with everything else, always remember there is a cultural emphasis to communication with patients. Cultural considerations involve a preference to communication style, eye contact, if touch is allowed or not. The cultural consideration must have a cultural filters so as not to form a bias or prejudice during communication.
I have a point. It is important that when communicating, remember that attending behaviors can enhance or can be a barrier when communicating.
So I need to be aware of eye contact, body language, tone of voice.
How do you feel about process recording?
I never tried it. I suppose I could see that it can be helpful when identifying how effective the skills of being an effective communicator. It can also show communication patterns in a therapeutic communication.